Welcome back to Behind the Numbers. This week we had what I can't describe as anything but a truly incredible episode filled with knowledge bomb after knowledge bomb. We were joined by Dr. Raywat Deonandan, an epidemiologist and professor with the University of Ottawa, who has made a bit of a claim to fame throughout this pandemic as an informant about all things COVID-19. Dr. Deonandan chats with us about the importance of communication and transparency, the need for compassion and empathy, the impact of coronavirus on our healthcare system, and his thoughts about how the whole virus is impacting the field of epidemiology. Enjoy, guys. So welcome, Dr. Raywat Deonandan. I'm very excited to have you on. I feel like it's not a true Ottawa Epi podcast without you, with A, being you Ottawa professor, obviously, but as well, you've seemed to come to fame, as we just said, through all this.
How did this happen?
Well, I mean, I think you've mentioned it before. People don't think you're studying skin now. So I think a little bit of progress.
Except I have an entire book called Nothing to Do with Skin, The Fundamentals of Epidemiology, which is now irrelevant because...
Everyone, check it out.
Yeah. I need those $2 that I get from Amazon.
How have you been doing throughout all COVID, though?
Well, I'm on parental leave at the moment, so my workload is quite low. However, lately the demand for media commentary on all things epidemiological has been sky high.
Through the roof.
And interestingly, there aren't a lot of us willing to make public comments. I understand why. It's we can talk about the pros and cons of this. I think it'd be an interesting conversation. But as a result, it's nonstop. And I now say no to about 11 requests a day and yes to about 4. And the worst is live television. Like I'm not trained for this. Live television is stressful.
Where's my makeup team? Hair team?
No, it's not that. Like, the dog is nipping at my feet and may knock over the tripod any second, and suddenly live, the nation will see that I'm not wearing pants, and it gets ugly fast.
Wow, I'm honored we made the short list.
No, podcasts are great. Let me tell you, podcasts will survive the apocalypse. So this is good.
Especially you say something that you're like, oh, don't want anyone to hear that. Just crop it out, edit it out. We're good. Which goes back to kind of what I'm guessing why a lot of people don't want to speak out about it. I mean, I think with social media and cancel culture, like, you have to be 100% on your game, say the perfect thing. If there's even an ounce of a mistake, you're 100% done, which is, I think, the scary thing.
That is what it has become. I don't think that is the original disincentive for supposed experts to comment. I think the original disincentive is something we all struggle with. I think every grad student watching this is feeling it and will feel it more. It's called Imposter Syndrome.
Oh,
so
yes.
We all suffer from it. All of us. Nobel Prize winners suffer from it. And the day you stop suffering from imposter syndrome is the day that you should stop commenting, because you're too full of yourself. So most proper scientists and scholars are so humble in understand what they don't know that they're shocked when asked for expert commentary. Like, what do I know? What do I have to offer? I feel that way every single day. And I think that's what the disincentive is. And then add to that the inability to articulate a message for the public that is phrased in such a way that is digestible at multiple levels of education and so forth. And that becomes quite challenging. But getting over that hump of expertise and self-knowledge is problematic. When this first started, many of my graduate students approached me with a desire to do something to help. Good for them, And I said, well, why don't you do public commentary? Why don't you go on Facebook and answer questions, respond to misinformation? And their response was, well, we don't have the expertise for that. We're not infectious disease specialists or whatever. Neither am I. What they fail to understand is the level of discourse that the public demands right now is really quite low. Things that you learn in your first year epidemiology course are sufficient to garner a great amount of wisdom in the public context at the moment. Detection bias, that's a huge thing. A lagging indicator. That's something a lot of people don't understand. If you can walk them through that, that's powerful stuff. So scientists in general, students in particular, epidemiologists specifically right now have to understand you have the skill sets to make a contribution in the public forum right now.
I've two follow-up thoughts on that. First, I appreciate you saying that everyone has imposter syndrome. It's a little comforting. I know. I mean, I definitely, even this podcast, people are saying yes. And I'm like, why do you want to talk to me? Like, it's bad. Like, so it's nice to know that I'm not just some little like person trying to make their way through, but that everyone's sort of feeling this together. So that's my first thing. But I think I forgot what I wanted to say for my second. As I was saying that, I got so excited about it. What was the last thing you had mentioned? Oh yeah, about us being able to speak to people. Another thing I think that definitely benefits is just being kind of able to navigate the information on the internet itself. And I mean, you in classes, you're reading papers, kind of having to decipher, whereas the general Googling has algorithms now that sort of gives you confirmation bias. So people who may not believe in COVID or may not think it's as severe as it is, they're sort of getting exactly what they think. And so being able to provide that other side of information and being able to say like, well, have you looked into this? Maybe this may not be true because of this, I think is in itself helpful, even if we're not totally experts on the subject.
One of the main reasons I encourage students in particular to get involved in the anti-misinformation movement, if I can call it that,
Yeah.
is to open their eyes to just how deep it is.
Yeah.
One of the shocking things that a lot of my students discover when they venture into the world of public discourse is how unprepared they are for the conflict. How can people possibly think this? That's the response. Well, yeah, people think some weird stuff.
Yeah.
And we are losing that battle because if I go back and think about back in the 80s, we had a problem with the rise of talk radio. Talk radio was pushing these hard right ideas into public consciousness. And the question was, why is this particular political mindset tailor-made for talk radio versus like NPR documentary footage? And the reason is simple messaging is tailor-made for misinformation. So why is that man homeless? It's because he's lazy. That's an easy message. A complex message is that man is homeless because of a variety of economic and social factors and medical factors. That's a complicated set of skills and arguments, rather. So similarly, we're at a point now where the misinformation rides on the wave of easy medium. Science by press release, science by YouTube video is easy. Science by peer-reviewed paper is difficult. So the truth has a harder path to follow, a tougher road of fewer eyes and a more complex language. And that is what we're up against. And when sorry, I'm giving a monologue here. I can talk forever.
No, that's okay. I like it. It's
good. So right now, my thoughts are on the communication issues in public health. And the last few interviews I've done in the media have been about, how can we improve communication? One of the challenges is when we were planning for a pandemic, we as a society of epidemiologists, we thought about, testing is going to be important, mobilizing resources is going to be important, getting the people on board is going to be important. No one thought that the communications challenge would be combating A, misinformation, and B, active disinformation. That second one is a huge one. So the misinformation is, people got some stuff wrong. Okay, let's correct them. The disinformation, there's a funded campaign from certain political quarters to mobilize the pandemic in a certain direction for whatever political reason. And we can theorize, foreign powers, whatever it might be, but there's money behind some of this. And you can't beat that with a couple of grad students on a Twitter account. Our salvation seems to be that in Canada, at least, the majority of people are sufficiently critical thinkers such that that disinformation campaign doesn't have as much penetration as it could, like we see in parts of the USA. So all of this reminds us that health is multidisciplinary and interrelated with other societal factors like long-term investment in science education. So that'll be my mantra going forward from now on, is this is a reminder for us to not take our eye off the goal of a critically thinking, well-educated, complexly, is that a word? Complexly educated population. And we've lost focus of that last couple of decades. So
okay, you're making like 500 thoughts spinning in my head that I want to get to you. Okay, so I'm going to start first with the communication problem. I mean, I even notice myself when I'm looking at the news. There's some places like Auto Public Health. I love that they kind of give a little quippy like guys, don't actually blame the people at the store. They're not the ones making these, like, things like that that just remind us, okay, stop hating each other. Like, let's just kind of get through it. But a lot of, and I don't know if this is part of the tactics or what, but it seems like there's also a lot of communication that ends up being very almost negative and just like blaming and shaming, which personally I find it a very difficult time when it already kind of sucks. You're like, although it's necessary, it does kind of suck to be locked down in your house, not being able to see people. We do need that human contact, but you're like, okay, at least I'm doing my part and I'm trying. And you're trying, and then you still get so much negative feedback that it's
counterproductive.
difficult. Yeah,
Yeah.
it's like I'm trying so hard, but there's no positive reinforcement. There's no like good job on at least not
Yeah.
overwhelming like the hospitals.
So there's a couple of thoughts come to my mind. First, you're bang on, and what you've struck upon there is a mode of operation in communications theory. So advertisers and motivators talk about the carrot and the stick. So far, we've been all stick. The stick is,
Yeah.
and carrot and stick comes from how do you motivate a mule, a
Yeah.
stubborn mule? You give him a carrot and you beat him, right? I'm an animal lover. I'm not in favor of beating mules. It's a metaphor. So the stick is scolding. You've been bad, young people. You're going to those parties, you know?
Mhm.
And the stick is also bylaws. I'll give you a ticket if you have this party. And it fails to acknowledge the fact that it's isn't all party goers. It's, you know, young people, for example, live in crowded housing. They can't distance. They're the baristas. They have frontline jobs. So we don't want to blame them. The carrot, as you point out, is missing. Is what is the incentive for proper behavior? Sometimes it's simply an attaboy or an attagirl. Sometimes it's the narrative of heroism. If you self-sacrifice, you can save a life. And sometimes it's, you know, if we can delay self-gratification, we can have an open economy sooner. So there's a selfishness in that motivation too. But I also think about um, so much of communication isn't about the science and the content. So now we're venturing into the area of knowledge mobilization, knowledge translation, something that I hope students think about more. We don't teach this a lot in science programs. We should, because it's a career growth opportunity and something that governments and funders are heavily focused on. So knowledge mobilization is, you know, getting information from those who have information into the hands of those who need to use it in a format in which they can use it. That's the cheapest definition. But it's a lot
Yeah.
more than that. It's understanding how human beings communicate and for what purpose. So we don't communicate via information. The purpose of language, in my opinion, is not information sharing. The purpose of language is society making, is relationship building. And so we communicate not via facts, we communicate via narrative. And the purpose of every story you've ever been told isn't to convey information, is to tell morality tales.
Yeah.
So a big chunk of public health communication has to be moral leadership. And moral leadership right now comes in the form of compassion, empathy, and sympathy. That's been missing completely from most
Yeah.
of the message we get from the province or even at the local level. You know,
Yeah.
and people are feeling it. And the longer this drags on, the more important that becomes. You can get facts off the website. You get empathy from a human face looking you in the eye with the appropriate voice, with authenticity in their delivery. You know, so the best leaders, I think of Jacinta Ardern in New Zealand, who's an excellent leader, and she clearly is an empathetic individual. You know, and that comes across. So, I mean, I'm venturing outside my realm of expertise, but it's something I do on a daily basis, this particular
Yeah.
topic. So I do feel fairly confident talking about it, even though I don't write papers about this. So in a couple of weeks, I'm doing a public presentation with Dr. Vera Etches and another scholar. And my portion of that presentation will be how we tackled the communications angle of this public health emergency. And to bring it back to, again, epidemiology students, who I think are mostly the audience for this
Yeah.
podcast, is this is something you got to start thinking about now. We won't teach it to you in class. We probably should. We won't. And increasingly, it is a desired skill set to have in the workplace and for your career in general. So the two major skill sets that really drive all employment opportunities, regardless of what field you're in, It's communication and analysis. So we focus a lot on the analysis in the sciences, statistics, qualitative stuff, programming. That's fantastic. Most people in the world can't do that stuff. Absolutely. Okay. The communication angle, the humanities do this well, not as well as you might think, but they do it well. We do it very poorly. So in general, people pursue careers along those two streams in general. If you can do both, as I think I can, then you have a lot more opportunities. So if you're a science student looking to maximize your opportunities in the future, look to augment your communication capacity. That means learning to write well for a variety of audiences, not just other scientists who are the most boring people in the world.
Yep.
But for the general public, learning to speak, off the cuff, and understanding why you're doing these things. I think everything comes from a core motivation. If I understand my motivation, everything else becomes fairly easy. Oh, I got all motivational speaker there for a second.
No, I love it. And I agree. I think you do a fantastic job. And I think that's why a lot of people, I mean, even all these news people who are reaching out to you, I think that's why they're reaching out to you, because you're explaining things in such a way that you don't need to have a master's to understand. Like, everyone can understand, okay, why is it so important that I'm social distancing, or that they're choosing this distance, or that, like, whatever it may be, that we can all understand it and just feel like we're on this same goal, rather than just for 6 months getting braided, wear a mask and social distance. It's like, okay, I understand that, but I just want to feel some connection to somebody.
Think about, I don't mean to say that people are children. People are not children, but in our hearts, we're all still 2 years old, right? So you're talking to a 2-year-old or a 4-year-old or whatever age kids start asking these questions. My kid is 4 months old. I have no idea at what point this is going to start. 2-year-olds and 4-year-olds are always asking, why? And for many of them, when you explain why they need to do something, they're more likely to do a thing rather than just do it because I told you so, which is never works. It breeds resentment.
100% like that. I need to know why I'm doing it, or I don't know what it is internally, but I'm like, well, you can't say I can't do it. What, you don't think I can? Fine, I'll do it.
That's right. It's a healthy way to be. It's an anti-authoritarian bent that leads you to greatness, but it can get you into trouble as well.
Yeah.
I'm the same way. I've been fired so many times. I get fired so often. I'm amazed I still have this job, to be honest. So
knock on wood.
Yeah, well, whatever. Clearly, you can fail upwards. It's fine. So it's such an interesting pandemic in so many ways. It's revealed the cracks in society as much as it has revealed the opportunities for epidemiologists to advance. And I do worry, though, for our profession. We are having our moment, but we're also breeding resentment because people are blaming us for the pandemic rather than seeing us as the managers of the pandemic. And I don't think it's going to end well for us. I don't. I mean, right now, I'm on the news a lot, and whatever fame I have, I'm not sure it's not going to end well for me. I don't think so. This is not going to go well. So this is not something we should aspire to have our profession be so visible at the moment. I think we're the best when we're in the background doing the grunt work and getting it done. And we need other leaders as the face of the activity to take the blame when it goes bad.
Yeah.
Yeah. Anyway, got off on a tangent there. More questions. Give me some questions. I took you off.
Now I have a question for very current times, just almost tying in the communication, but also just how to find a little bit of almost not optimism, but just almost not be absolutely scarred with fear. So we're kind of heading into the second wave, or we're already kind of in it. We've already surpassed the amount of cases that we had the first wave. We also don't have as many deaths. I want to know whether this is something we can maybe be optimistic about. Is it maybe mutating to a potentially less severe form, or is it just because we are now testing everything? We in March, we didn't really know what was going on. You had a runny nose, you weren't getting tested. Now anything happens, everyone's getting tested. So is it just by pure numbers that we're getting more cases, but maybe those hospitalizations are sort of staying the same? I don't.
Right. Excellent questions. And these are these same questions everybody else are asking, right? So I'm going to approach that question through the lens of this podcast, which is meant for epidemiology students,
Yes.
right? So the first thing is, I've been really careful lately not to overstep my expertise. I think in a public health emergency like this, we got to keep to our lanes. And so let's deal with the mutation question first. I'm not a virologist, so I cannot speak to that. I'm tempted to speak to it, but I can't. What I can say is that there is a theory that pathogens with sufficient access to a host, as this one does, eventually mutate or evolve towards less lethality. And I use those words specifically. So mutations are random, but natural selection applies pressures for which the less lethal one eventually is selected, because why kill off your host? That will take years for that to actually happen, though. That is the theory as I understand it, but I cannot comment authoritatively.
Yeah.
What I can say is the epidemiology. The epidemiology, if people don't understand yet, is how we look at the numbers and assessing bias and so forth. So let's compare this current wave, I call it resurgences, to the first surge back in March. What's different? Well, we have the same number of cases, but as you point out, yeah, we are testing, a lot more, maybe 4 to 10 times more in some cases. So we are finding more cases, and we are finding more milder cases as a result. If you're only testing symptomatic people, especially the most symptomatic, you're going to select for the more serious cases who are more likely to be hospitalized, more likely to die. So I anticipate that the proportion of cases needing to be hospitalized, and therefore the proportion that will die, will be much smaller than the first wave. That's not the crisis before us. The crisis before us is in capacity overwhelming. That was the original crisis too, but we avoided the original crisis because we shut everything down. We shut everything down. Schools were closed. Healthcare workers were at full power. The long-term care centers were filled. Elective surgeries were canceled. People were told to stay away from the hospitals. So all that capacity was there. We had about 200 to 300 ICU beds filled in Ontario back then. Right now, we have fewer than 30 ICU beds filled by COVID cases at the moment. But right now, even though you're right to say it is artifactual that this peak is as high, if not higher, than the first one because of the advanced testing, we have less capacity because everything's open. Schools are open. All the surgeries and procedures that were canceled back in March, we're still catching up on. They're still happening. The flu is upon us, and the flu every year fills up hospital beds. People don't realize that. So there's less wiggle room. Now, as David Fisman recently tweeted, there's still room at the end, but we're running out of room at the end pretty fast. So that is the danger. I think the media has done a bit of a disservice in painting this as the bubonic plague, that we should be afraid of bodies strewn across the road. That is not what we should be afraid of. So I'm actually going to record a video just later today on this very topic, talking about how one of the COVID denial narratives at the moment is, why should I be afraid of a disease that's 99.5% survivable? And the answer is, you shouldn't be afraid. You should be respectful, but not afraid. And the reason for that is, this is not a individual risk scenario. This is a population risk scenario. And this is, again, where the epidemiologists come to the fore, because we specialize in population risk. So with an IFR, infection fatality rate, of about 0.6%, let's say it's 0.5%, that doesn't sound like a lot. That's a huge number for an infectious disease that with a reproduction capacity that is as high as this one. So by the time it burns through 70% of the population in Canada, you've got, 25 million people infected. 1% of that is 250,000 people. 0.5% will be 125,000. That's 125,000 deaths. That's a lot of death for a disease that is 99.5% survivable. So that's the first thing. That's not a calming statistic. That's a scary statistic.
Yeah.
But we won't get there because we have these procedures in place to prevent it from getting there. So you should not be afraid of the death count. You should be afraid of the overwhelming of the capacity of the hospital system. So be respectful of a disease that will make life difficult for many people. Don't be terrified of a disease that probably won't kill you. Right?
Yeah.
So it's that shift from understanding this is not about you and me. This is about the community as a whole. When you understand that, okay, I'm going to do my part to keep my community safe. And, the fear narrative worked for a little bit and it had a role to play, that wasn't going to take us all the way the next year or two, which is what it might be.
Yeah.
What's going to take us the rest of the way is the narrative of responsibility, unfortunately. And this is where the crows come home to roost. Is that a saying? What comes
I
home?
have never
Pigeons?
heard that.
Do pigeons come home to roost? I don't know. Something comes home to roost. And the thing that's coming home is our failure in the last couple of decades to invest in science education and in civics, which is our responsibility to our community. Now, Canada
Wow.
is doing this better than the USA, no question. Everywhere around this country, I see people willing to sacrifice and understanding this is about keeping our system going because we're proud of our system. In the USA, it's more individual focus. It's like, well, it doesn't affect me that much. This is about people, preconditions and older people. That's my American impression. So this is a local podcast, right? We'll be seen by Americans. Okay. So what's the optimism? The optimism is it's not that lethal compared to other things in your life. So you should not be afraid of it. That's the first thing. The other optimism is that we can keep society open. We just have to be strategic and focused. We can close certain things we know are problematic, like indoor dining and bars, super spreading opportunities, and we know about exponential growth. Okay, this one's key. The human mind is pre-made. It's hardwired to think of linear growth, right? And 2 cases today, 4 cases tomorrow, 8, whatever linear growth is, right? But exponential growth is hard for us to think about. And because exponential growth everything seems normal for a while, a little bit of growth. All of a sudden, next day's bang. And by the time you see this, it's too late. So we're starting to see this, but we still have a chance to prevent that. So that is the optimism here. It's still early. We can prevent this from happening. And by the way, this might never happen. We got to be humble and understand that these predictions might not come true. Absolutely, they might not come true. We might be Chicken Little, again, as David Fistman tweeted recently. We got to be okay with being Chicken Little, because this is all about preventing disaster, sometimes at the expense of your credibility. So when I say this won't end well for me and epidemiologists, it's because if we do our jobs well, we prevent catastrophe, no one will ever know that we did, and will think that we're Chicken Littles and we're just, alarmists.
Your whole chat here it's almost as if you knew what my last question was for you. You segued so well with all the talk about just like our system and the capacity of it. So some of the facts I'm going to spew out are just from, I took actually a COVID course over the summer with Dr. Browers, and it was fantastic, but we had to choose some sort of like hot topic thing to talk about COVID and write about. So mine was just kind of about how like the problems it's bringing to light that we've had, and it was something that made me a little frustrated, that I'm hoping you can maybe make me more optimistic about how we'll come out of COVID. Because say after SARS, during SARS, there was the whole gung ho, okay, this was horrible, let's prevent this from ever happening, let's be prepared. Then there were quite a few audits after that continued over the years to show, okay, we still are not keeping great track of our equipment. We are not ready for another pandemic. There's ventilator shortages. I think in September 2019 was the last one. Even WHO and John Hopkins, both of them individually, had done reports that showed we are not no one in the world is ready for any sort of other pandemic. In 2019, there was 40 hospitals in Ontario that were already at 100% capacity. Wait times were going up like 30%. Funding was being cut over the past, say, decade or whatnot to healthcare. Now, do you think that we've kind of been in a trend of something bad happens, we're in the middle of it, there's a sense of urgency, it goes away, and then there's a lull, and it's like, oh, out of sight, out of mind.
Yeah.
Like, forget about it, we'll be fine, and we'll deal with the next one when it comes. Like, do you think this one is bad enough that people are really going to pay attention, that we need changes to our healthcare systems, hopefully in the long term? Or like, I'm just scared that it's going to lull out again and nothing's going to change.
So what's the right analogy here? I don't think SARS is the right analogy. I think the right
Mhm.
analogy is 9/11.
Okay.
So after 9/11, the world changed
Yes.
for a couple of years.
Yeah.
Some things after 9/11 are still with us. So yeah, I mean, other than the wars are something separate. So the
Yeah.
downfall of the wars is horrible. But things like security at airports, that's still with us. Um, Me as a brown guy getting strange looks at airports, that's still with us. You know, added border checks when you drive to the U.S., that's still with us. Showing multiple IDs before you get onto the Greyhound bus, that's still with us. So some minimum sense of security is still there, despite it being 20 years after 9/11. With this, I think we're going to have 3, 4, 5, maybe 6, 7 years of diligence and terror because the world came to a standstill and suffered economically, which is intolerable
Mhm.
for most people. Um, and then we'll let up on the gas. I'm actually more hopeful that the private sector will take it more seriously. So there are some companies that do epidemiological forecasting, that do pandemic prediction, and they're doing really well right now. And they're actually better at it in some ways than governments are. And I think they're going to thrive for a while because the big companies understand that they can't afford not to be prepared for the next one.
Yeah.
And so long as the big money Fortune 50 companies are keeping their finger on this, I'm confident that we'll be a little better prepared, at least at the surveillance end of things.
Hmm.
At the societal end of things, in terms of hospital capacity and response, no, I think we're going to be deep in it for a long time. So the trick then is not to get to the point where we need to respond. The trick is to look heavily at surveillance and prevention. In Canada, there was a 2019 global security audit ranking countries in terms of their ability to respond to biological threats. Canada ranked, I think, eighth in the world. USA was fifth, I think, if I remember correctly. But our strength was our testing and laboratory capacity and our human resources, our well trained scientists and technicians, which is a good thing. And we have a good domestic surveillance system. The world failed in general in terms of global disease surveillance. And my push right now, to the extent that I have any authority to do to argue for anything, is for us to redouble our efforts on global surveillance, um, not just on infectious diseases, but any potential new disease. Because surveillance is cheap, it's inexpensive compared to responding to a disease, and somehow we've lost track of that. Other things that we can do locally are information technology investments. So we, after SARS, we started investing in Panorama, that new platform to move public health information from the public health unit
Hmm.
upwards, and that just crumbled in ways I don't fully understand. And that was because we just took our financial eyes off the ball. So I anticipate what will happen in Canada. I can make a prediction. Much like after SARS, there was a royal commission that resulted in the creation of PHAC. There'll be
Yeah.
another royal commission. They'll create some other institution. It'll get bloated, and nothing will happen. But but I think the private sector will keep its eye on the surveillance ball, and if epidemiologists are clever, I think we will make deeper relationships with private sector researchers to get access to that surveillance signaling. Who knows? I'm talking on top of my
Yeah.
head here, but excellent question, right? So there's a paper I read back in 2007 that I quote all the time. This is lessons learned from SARS for the next pandemic, and it had three lessons, just three, and I quote these all the time, and it's amazing how relevant they are.
Yeah.
I'll go in backwards order.
Okay.
So the third one was animal husbandry is bad for human health. No, I'm an annoying militant vegan. Of course, I love that one. We should,
Yeah.
but I understand the rest of the world does not share my dietary restrictions. But there's something to be said for our our need to disentangle our nutritional activities and our industrial activities and our agricultural activities from specific and diverse animal species, because that's
Totally.
where, as epidemiology, we know zoonotic diseases drive most of these pandemics.
Yeah.
The second one on that list was 19th century technologies are still the most effective. So mask wearing and distancing, hiding in your house, still has the biggest bang for your buck.
Yeah.
And that's shameful given that we are in 2020. Now, finally, we have apps and we have these new viral vector vaccines that we could not even have 5, 6 years ago. That's amazing. They're going to be quite powerful. So I think there has to be a focus on using the new technologies to help in surveillance and to help in treatment and vaccine development. So AI will have a role to play in this. It might mean we're going to have some diminished public liberties at the expense of surveillance. So 5G networks, et cetera, will be useful in building smart cities for better disease monitoring. That doesn't fill me with joy, but it is a way forward.
Mm-hmm.
And the first one, which brings us full circle back to the first thing we talked about, that I'm stunned that this was written 13 years ago, and I got to cite it continuously, is that transparency and clarity in messaging and communication is key.
Yes, preach.
Right? And so this pandemic began with China being a little obfuscating of the true nature of its epidemic. And it's gone downhill since then. We can't get access to data, even as scientists. We can't, even today as we speak, we have our testing numbers are down, as you noted, and so therefore the case numbers can't be trusted. So the data is unclear. We can't get a straight answer out of our public health leaders from the provincial level and federal leader around certain things. So what is the citizen to do who doesn't have advanced training in epidemiology? I really feel for them. So I think we now live in a time when, so I'm off on a tangent again, but we live in a time when social media exists. We have instantaneous communication between any two people on the planet. We have active political actors driving disinformation into our minds. So transparency is everything now. And transparency means admitting, I don't know this, and therefore I'm going to act in this way with the assumption that as more information comes in, I will redirect my path. So that little nuance, I think, could have bought a lot of goodwill from people who are questioning, how come you're saying masks are good now, but you didn't say it X months ago? Because the data changed and our understand and the way we thought about it changed. People change, right?
Yeah, there's and no it's that people get so frustrated. It's like, don't you want us to change our opinions as we learn more?
Yeah, exactly. Yeah, exactly. And I get it. People are afraid and they want scientists to do science, meaning get us answers.
Yeah.
But they don't understand how science works. I don't blame them because, again, we have not invested in science education to the extent we should have. So they don't understand that this is a living process. And the other shoe, of course, is, well, how do we know you won't change your mind tomorrow? You don't know. You don't know, right? So it's a long answer to our question.
That was such a wholesome full circle moment, though. I love it. Came right back to communication. It was great.
Thanks. No, there's so much to talk about this, and I'll stop talking.
I feel like there's like knowledge bomb on knowledge bomb, and every single one, I was like, I could ask 500 questions about this and stay here.
We'll do it again. Another episode.
That'd be, seriously, episode 2, we'll finish off every other question that I need to write all these down, so I got them for you, because I already kept you over time. But I appreciate you staying on for it.
My pleasure. Thanks for having me.
Yeah, this is fantastic. Thank you seriously so much.
Cool.
Bye.
Bye.
Thank you so much for tuning in. If there's one thing that I hope you take away from this episode, it's that we all need to have a little more compassion with each other. And while you may not personally fear this virus, you do have to respect it. Also, you should all seriously head over to Twitter and follow Dr. Deonandan at Deonandan, or head to his website at deonandan.com to stay informed in a rational and educated manner. I enjoyed learning so much from him, and I hope you did too. As always, don't forget to follow, like, subscribe to us on Twitter and Instagram at Behind the Numbers with no E in numbers, as well as on YouTube. We love hearing your thoughts, so leave us all the comments and messages. Thanks everyone, and see you next Monday.